Growing up, I was always the fat kid. I don't ever remember being a skinny child.
But they did another bone scan and she went from 7 years old to 13 years old in a matter of 2 years.
I've been through everything. I starved myself. I did it all. Literally, I did it all. And they would all just say, no, she'll get better. She'll get better. She's just young. She doesn't understand. I went to see the endocrinologist. He literally was not happy. Like, this surgery was like the worst thing he could have heard of. You don't need this surgery. You could just eat healthy. You could do this on your own. You're taking this easy way out. He attacked me with everything.
We've documented what she's eaten, and then they look at it and you always get this feeling like, well, there's got to be something. You must have forgotten to write down, but like I give her a candy bar with every meal or something.
And essentially told me that there's really no hope for me and I would be better off in an underdeveloped nation, in starvation conditions, and I was probably meant to live there.
That's how doctors approached it, almost on a fear basis, and they would try to scare me.
Like, just prepare for diabetes and prepare for heart problems was not the best solution. There has to be a better way to address it than just to allow it to happen.
I'm Molly Bash, and I am a pediatric psychologist, and I work at Children's National Hospital in Washington, D.C. One major influencer of weight-related stigma is some negative assumptions that we have about that person's characteristics, their personality, about their willpower, and that is a personal responsibility that they developed obesity. Obesity involves many different factors, including biological ones, environmental ones, as well as behavioral factors. In the Harvard implicit bias test, physicians actually show strong levels of weight bias toward patients with obesity. The individual might actually not know or even understand themselves to hold this type of bias. Are you spending less time with your patients with obesity? Are we avoiding eye contact? Are we using judging, blaming, shaming types of words? It can really impact the mental health of these youth. They're at a higher risk for anxiety, depression, and suicidality. A common bias is less adherent or not adherent, non-compliance. And so when a person perceives that label, that they tend to internalize that label. Wow, this person is assuming this. Maybe it's true about me. And then they may actually start kind of performing sort of in that way of the non-compliant patient, regardless of what weight status a child starts off with. If they receive bias or receive negative comments or discrimination related to their weight, they are much more likely to gain weight and much more likely to fall into the category of obesity later on in life.
My name is Dia Ahmed. I'm 19 years old from Montgomery County, Maryland, and I'm a full-time student at the University of Maryland. I'm studying public policy and econ. I'm a double major. I want to work in government someday, hopefully trying to fix healthcare policy. I like to work out. Anything active, I'm down for. Growing up, I was always the fat kid. Everybody's always been concerned about my weight. My eating habits are watched carefully. I'm shamed every time I pick up a snack. This is like since a child. And that led to me eating by myself, away in my room. That led to me whenever I had access to money, I didn't know how to control myself, and I would go to stores and spend hundreds of dollars on snacks every week or two. When you're just constantly being observed and watched, and it makes you and criticized. It really did make me depressed, and I think that led to me eating more food and eating to fight the depression, etc. Like seventh grade, I vividly remember the thoughts that would go through my brain. It was like, I'm not enough. I'm not good enough. Why don't people like me? And that turned into, why do I need to be here? Why, those like suicidal thoughts. And I was still going to the gym a lot. I was still working out a lot. But whenever I'd go home, I'd eat and eat until I couldn't eat no more, because I was just having such a rough day. When you're dealing with depression and anxiety and whatever other ailments that come with obesity, then you won't be able to lose the weight, just simply because your mind is a wreck. 2 or 3 doctors told me that I was in very high risk of diseases such as diabetes, and they would try to scare me. I had a physical, and they're expecting, like the genitalia, and he was like, yeah, and there's fat covering the area and all that, and he was like, you're not going to be able to fertilize a woman if you are too fat to essentially have intercourse with her. So this was when I was 10, 9, 11 maybe. So I was very young. I didn't understand what he meant. I actually put the pieces together as I got older, and that's how much is stuck in my mind. I didn't understand what he meant, but now I do. Once again, doing a physical, the doctor is touching my chest, and she's like, oh, you have breast tissue. And she said it kind of in a low voice. I don't think my dad picked up on it, but I definitely did. And I was 12, 13 years old. You don't really understand much, besides the doctor just told me as a young man I have boobs. And that's what stuck in my mind, and to this day I'm insecure about that. That's how doctors approached it, almost on a fear basis. And then they'd go outside and talk to my parents, and I'd never hear those conversations. But immediately after those conversations, my parents would get a gym membership, and they'd force me to go to the gym. And kind of they pushed me away from sports. I had a few doctors. I played football growing up ever since 5th grade, and I had a few doctors that said I should quit, since football wasn't helping me lose weight, even though it's something that made me feel better and was exercising and was fun. They quite literally would tell my parents, have them quit football, have them quit sports, and just work out. My mom acted, on the doctor's advice, and acted as a drill instructor in front of the entire gym for about 3 months, just yelling at me to run. And I come back to the doctor's office, and I had gained weight after all that. And that takes, once again, a mental toll on you when you have your mother as a 12, 13-year-old boy yelling at you to run faster on a treadmill in front of the entire gym. My whole life, my pediatrician simply just focused on the exercise component and never addressed the nutrition.
Hi, my name is Stacy Dorsey.
My name is Deja. I'm 11 and I'm in the 6th grade.
Deja was about 4 years old when we first noticed the first signs of her weight and her height issue. She just shot up real fast. She gained a little bit of weight. And it all kind of occurred quickly. That was also about the time where we found out Stasia was diagnosed with autism. It's one thing after another. And when it comes to what she's eating, where she should go, how much activity she's getting in, and all these things we were already focused on just because of my history. And I was an obese child. And I myself had gastric bypass. I was about 11 years old when I was getting close to 200 pounds. At 16, I was over 200 pounds. And when I graduated from college, I was about 250. About 50 pounds got put on in about a year, and I was 300 pounds in 2004 when I had surgery. I've lost over 100 pounds, and I've kept that off for 17 years now. I didn't want Stasia to have to wait till 24 to check enough boxes to say, okay, well, maybe we'll do something now. Yeah, so when we would take her to the doctor's appointments, the first thing is, what are you feeding her? What's she eating? How much soda she's drinking? This kid's never been a soda drinker her entire life.
It's too busy. I don't understand how people drink it. I'm also very sensitive to taste, so I can only eat specific things, and it especially goes for texture. It's like if the texture isn't right, or if it's how it's cooked isn't right, then I can't eat it, eat healthy or unhealthy. It's just that's the whole reason why I don't like McDonald's, is because it's like their food. You can taste how unhealthy it is.
You know, every time they tell her to go do this, you know, she did it and there was no big result. The bigger she got, the harder it was to exercise. Stasia has been in ballet. She has been in gymnastics. She has been softball. She's played
tap dancing for
She did tap. She's done a lot of activities. No one would say, well, here's how we're going to stop it. Here's how we can fix this. I knew from personal experience that it was going to hurt her heart, diabetes. You know, they would give us the list of things of here's everything that's going to happen. You know, let us know if, you know, she starts passing out because it looks like sugar issues, or, you know, if she starts feeling bad all the time, or if she gets tired all the time, which are all things that it was kind of like, this is what we expect to happen. She's going to gain weight, and then she's probably going to get diabetes, and then she's probably going to, have trouble sleeping. Sleep apnea was another thing. That's probably why she's snoring. It was like, here's why all this is happening.
It's very difficult to think positive when you got to go to a million doctor's appointments because of your weight, and that's it. Well, mainly that's the point, but yeah.
I can imagine. I remember you're overweight, or you're not where you're supposed to be at 11. You know, it's, if everybody is always saying that to you, it's like that's all you want to do is put this wall up.
Some doctors are unhelpful. I never listened to the appointments ever.
You didn't ever?
No. That always made me sad. I don't like crying at the doctors.
Just telling me that, hey, this is what's going to happen, and like just prepare for diabetes and prepare for heart problems was not the best solution. There has to be a better way to address it than just to allow it to happen. I want her to have fun and be an 11-year-old.
It made me think about how I used to hate clothes shopping because I had to do it so often. But then the older that I got, and now, I really like shopping. And my dad doesn't believe me that I like shopping, but it's true. I like shopping. And I like shopping for clothes that I actually do like. And I like it when I can find something that fits me properly. And I still feel comfortable in it.
I want for her what I had, just sooner than I had to wait, if that makes sense. I want her to enjoy it in high school and college, where I had to wait until I was a young adult for it. I just don't want that for her.
My name is Melanie Serena Velasquez. I'm 17 years old. I'm in my first semester of medical school. I want to become a doctor because I had cancer twice. So I'm a 2-time cancer survivor. I was diagnosed when I was 4 years old. When I was 4 years old, I actually told my doctor, Dr. Owen, my oncologist, I would be just like him. He saved my life. So I want to be able to give back. And you can always tell when a doctor cares and when they don't. That's what makes a good doctor, the heart. When I got cancer, I started getting a lot of weight. So it's part of the steroids. You gain a lot of weight, water weight. You want to eat all the time. You're very anxious. Steroids also cause behavioral issues. I kept gaining weight. There was no way for me to stop. It was something that I needed to eat. I needed food. It made me feel better. I would hide food. So I started getting obese, started gaining more and more weight till I finally get up to almost 300 pounds. One of the things that chemo gives you is that your bones are weak. They become weak. So weight on top of weak bones, on top of I have knee problems. I had a knee surgery because of my weight, as well as heart problems and lung problems. It all goes along with it, especially since I had breathing problems because of the chemo. But what doctors would tell me about my weight is, yeah, she had cancer. Yeah, she'll be fine. She'll lose the weight eventually. Yeah, just give her time. Yeah, let's get a new diet. Let's get a new nutritionist. I've been through everything. I starved myself. I did it all. Literally, I did it all. And they would all just say, no, she'll get better. She'll get better. She's just young. She doesn't understand. And so there's a point where you just think you're not good enough. Like, you're just not going to ever lose the weight. Like, it's just a lot easier. People are going to laugh at me. People are going to make jokes. I'm never going to be able to wear clothes that I want to wear. That's fine. Like, you know what? It is what it is. It's going to be like this. It's the life like I had to live. I had cancer. I got big. What can I do? I can't change it, because people laugh a lot. People laugh, make jokes that aren't funny, because they don't understand that just like anorexia is a disease, obesity is a disease as well. So I got to that point where I was just like, I can't do this anymore. Like, what happens when I graduate? Is my life always going to be like this? I went to see the endocrinologist. He saw me and he literally was not happy. Like, this surgery was like the worst thing he could have heard of. That was the worst thing I ever did to his day. He literally made me stand up my whole consultation with him, because he says, you burn more calories standing up than sitting down. You don't need this surgery. You can just eat healthy. You can do this on your own. You're taking this easy way out. He attacked me with everything. And imagine how I felt with my dad sitting right there, me trying to convince my dad that I need this surgery, that I want this surgery, when a doctor is telling my father she doesn't need it. That's in her mind. She's big because she wants to be big. She doesn't eat this. She doesn't do this. That's why she's like that. So obviously I felt like crap. I just couldn't, I didn't know what to do at that point. I felt like I was in middle school again, getting told that I was too big, not good enough, not this. So he brought me down. I was so mad. Like, I just wanted to go off on him, like, so bad. I felt like he didn't understand what I had gone through, my cancer, my journey, everything, my bullying, like everything. He just didn't care. That's someone's life. He didn't think about my life. That was my life in that moment. It was in his hands. His yes or no was the rest of my life.
My name is Rachel Badabiel. I am an a pediatric emergency medicine physician, and I am also a physician scientist. I've always really been interested in obesity and sort of the physiology and pathophysiology behind obesity and obesity-related disease. And a lot of that comes from personal experience. My father growing up, he was quite large. He was basically between 500 and 600 pounds for most of my life, and always sort of trying to find a way to lose and kind of suffering from this, but also still trying to sort of live his life, kind of always affected by what culture was saying, like our society was saying about him. I would say most of my father's relatives were all suffering from obesity for most of my life. And I personally was diagnosed with obesity from a young age, despite many efforts by my family and me to sort of lose the weight. It was never truly successful. So I would say going to the pediatrician was never a very fun experience for me. I feel like there was always this dreaded moment where I knew they were going to pull out the weight chart. And there was a lot of discussion about why we weren't trying to lose weight. I did exercise. I, at different times, played soccer. I was on the crew team. I would run a few miles every day. Through different times, starting probably in around middle school, I had tried Weight Watchers, Nutrisystem, Slim Fast, Jenny Craig, various sort of commercial diet programs. It didn't matter if I went in because I, broke my finger, or I went in because I was dealing with something that really was related to obesity. It didn't seem to matter. It always came up, and it always seemed to be the focus of every appointment. When you're frustrated and you've been trying everything you can, and you're still kind of feeling what is essentially chastised, being told that you're chubby or fat, because those words were used, it just made me not want to go see the doctors anymore. And to this day, I still get nervous pretty much going to see a doctor. I am a doctor, and I'm still getting nervous to go see the doctor every appointment. I'm just always afraid that it's going to turn back to that experience of like, why aren't you trying? Why aren't you doing more? Why are you lazy? Maybe stop eating chips and ice cream. There was a lot of that. When I was in college, seeing a physician who I really went to him trying to explain what was going on. I felt like I was cutting down my calories and the amount that I was eating, and I still wasn't losing any weight. And I showed him sort of this diet journal that I was keeping, at which point he basically told me it was not impossible, that I must not have been telling the truth in my diet journal, and that if it was true, I was probably meant to live in an underdeveloped nation where there was scarcity of resources. He continued to tell me that he had just come from kind of a big conference on obesity, and ultimately it was a losing battle, that we don't really understand how to help people lose weight, and there wasn't really any hope, but I should just keep trying. And that was an extremely frustrating experience. Even in my medical education, these issues came up. I think starting from lectures, where I remember personally dealing with polycystic ovary syndrome, and one of the lecturers put up as their first lecture slide on PCOS a picture of the bearded lady in the circus, and kind of making jokes about that. And that as I was suffering with this and had actually just been told I had PCOS, and a very maybe uninformed medical provider at that time told me I'd probably never be able to have children. So that was a personal struggle of mine. And then to see it portrayed as just this bearded lady in a circus and people laughing about it was pretty hurtful. And so I think there's a little bit of that idea that even in medical education today, that ultimately obesity is a result of laziness, is a result of lack of willpower, that people who have obesity aren't trying. And it wasn't just in the classroom, and my clinicals as well. I remember being told at one point that I would probably be a better provider and my patients would take me more seriously if I worked on my own body habitus first. And I just thought it didn't matter how I did clinically at that time or how good of a doctor I was, maybe I was never going to be taken seriously. And so that really affected me personally as well.
The most important step is just increasing our own awareness of our own biases, noticing our emotions when we're interacting with different types of people, to pick up on like, ooh, that, like I noticed that I was feeling uncomfortable there. Being really, mindful of not using blaming terms, not using terms that communicate judgment. We don't want to avoid talking about weight, but we want to approach it in a gentle way, knowing that it's a very sensitive topic.
It's important to use first-person language. Completing medical documentation, don't use obese as an adjective, as in an 8-year-old obese male. Rather, try to refer to it as a medical condition. So do say an 8-year-old male with a history of obesity.
Another thing that can be really helpful is to ensure that our healthcare environments are inclusive.
There's already sort of this mental health challenge. And so it's really our responsibility to help them find the hope and to make sure that we're treating them with compassion. There are a variety of new treatments available for obesity, including medications, weight loss surgery, and mental health counseling as well.
We had our first referral to go to Ideal Clinic, and it was the first time people started talking about what can we do to stop, the continuation of the weight.
When I was first welcomed by the nurse, it really felt like she respected me, and that was something I wasn't used to. And after talking to the doctors, they really felt like they respected me and cared about me as a person first.
And he didn't make me feel like he's like, no, you're big because you eat a lot. No, you're this because you do this. No, he's like, look, we all go through stuff. It's something that happened and we just gotta figure out.
My mom would be putting in negative comments that I didn't like, and Dr. Nadler, Dr. Vadia would realize this, and they'd ask them to step out the room. And that really, really empowered me to be able to have a doctor respect you that much, to where they are willing to kick the grown-up out the room because they understand that you are, this only affects you, really.
I started to see a bariatric surgeon after I started to learn about the effects of bariatric surgery in medical school. So despite the fact that I had been asking doctors for years for help, I didn't really understand or learn about bariatric surgery until medical school. I would say that in that surgeon's office was the very first time I ever felt like somebody understood what I had been through and was really compassionate about that. He looked me in the eyes and he said, "It's okay. It's going to be okay. We're going to help you. You've been through a lot, and I know you've been through a lot, and I know you've been trying, but we can help." It's been a really life-changing experience because I've lost a lot of weight, and I would say my quality of life has just improved dramatically. After surgery, I remember waking up and, feeling a little sick initially, and then starting to recover from that. And within maybe that first week or two, I started to notice that I wasn't really hungry anymore. And I can just remember crying. And my husband asked me, he was like, "Is everything okay? Are you in pain?" I said, "No, I'm just so happy because for the first time in my life, I'm not hungry." And kind of realizing that maybe not everybody felt hungry all the time, that this wasn't something I had to feel all the time. And that was just really exciting for me. Sorry, I'm getting teary-eyed. My makeup's going on.
It completely changed my relationship with food. Food transformed from becoming that friend that I could go to whenever I was feeling down to becoming that friend that helped me be better every day.
Everything went away. Once I lost the weight, I never knew weight could do so much to a body. My knee problems, my pain in my legs when I walked, I had like terrible pains. That all went away. I can go to the gym for an hour and I'm fine just like anyone else. So it's better to take control of things when you can than just wait till it's too late.
But there's also a mental health component to facing stigma and bias from society in general for years. So if we can intervene sooner and we can save people from that component as well, we can really make a huge difference in their quality of life.
I went from hating myself and doing this because I hate myself to doing this because I love myself and I want to see myself be healthy and I want to see myself be better.
It's just I've changed completely in all types of ways I've changed. Yeah. I feel like I'm content, like I feel happy, like I feel like I'm good enough.
But if you're taught to love yourself and lose weight from a place that isn't dark, that isn't where you hate yourself, I think that leads to far better results and a healthier population overall.
Let's focus on the good life.
I try to keep my expectations low, just in case I get disappointed, just in case, but yeah.
When she walks into any store and can buy any clothing that she wants, it'll be a change.
So that means I can buy whatever I want.
I don't say anything.
We need to make sure that we can give people hope. There are treatments for obesity out there. There are treatments that work. I think, even most recently, these like GLP-1 agonists are showing promise. And of course, bariatric surgery for so many people has really, really helped them. And I think we need to make sure that when we talk to patients, we do it with that in mind, that we're there, we're compassionate as we would be for patients suffering from any disease. I can't imagine even looking at a patient who's dealing with cancer or something very serious and saying, "Oh, there's no hope," because there's always hope.